at a steady number. So we'll go forward. So today is really intended to be a primer. So this is a 3-part exercise series. The original invitation had Dylan as well as Adam on our team. Adam is unfortunately out sick today, and so Becky will be joining the session and Dylan will be leading. And again, today is really intended to be a primer on the importance of exercise, and in particular, the importance of exercise for individuals living with neurological conditions. So it's not going to be a live demo of the app, and we're not going to talk about the specific content and the system itself. That will begin in next week's session. So next week will be more of kind of a hands-on tutorial where we'll talk through the actual programs, but today is really just a general foundational knowledge session for us to talk about exercise and share our knowledge. And so with that, I will send it over to Dylan.
Hi, everybody. I'm Dylan. I'm one of the mobility specialists for Psionic. For those of you that don't know me, I know there's probably quite a few people that do, but those that don't, I wanted to give just a quick, brief background on who I am, so that way you know where I'm starting from. My background is in human performance, and I also worked in a physical therapy clinic for an outpatient physical therapy clinic for about a half a decade, and did a lot of neuro personal training during that time. So that's how I found my way over to Psionic. So just want to give that brief overview. And then again, as Anne said, if you don't get any of your specific questions asked, just remember that this is a 3-part series. So there's going to be plenty of time to get everything that you need covered over these next couple of weeks. With that being said, looking at the agenda today, we're going to be covering the benefits of exercise in relation to your activities of daily living. We'll look at weight-bearing versus non-weight-bearing exercise, and then the SAID principle of training. So we'll cover all of these things. The goal is for us to go kind of per slide, and then have mini Q&As in between slides. So that way we get more specific things answered, and then we'll have the wrap up and a larger Q&A towards the end.
Great, thanks, Dylan. And so real quick, everyone will see there should be a Q&A button. And so if you have questions for us, feel free to submit them throughout. We'll be keeping an eye on them, and we'll either ask them during a specific session or section of content if it's related to that section, or we'll save some time at the end for additional questions. So again, open the Q&A and please submit any and all questions there.
There we go. Benefits of exercise is our first topic. We're going to look at 3 different things when we're talking about the benefits of exercise. We have neurological maintenance and improvement, and then we've got aerobic exercise and resistance exercise. So what do we mean when we're specifically talking about the neurological maintenance? Let me pull up my notes here. So neuromaintenance is defined as a relative lack of decline in one or more measures, and it's not in absolute terms. So when we talk about relative versus absolute, absolute's talking about the broader population, and relative is bringing it back to you. So what do we mean by this is your performance measures are going to be specific to you and not to anybody else. So everybody's going to have kind of a different journey when it comes to their neurological maintenance, again, or improvement. So your performance measures can and are going to vary greatly from person to person. And we have a couple things that we look at when we're talking about neurological maintenance. There are what we put down as 3 very specific things that kind of, set the stage for how you can maintain or improve your neurological condition. The first one is your current level of mobility. So everybody is going to have a different starting point. Some people are going to be more or less mobility inclined, and that's a matter of fact. And so everybody's ceiling for maintenance or improvement is going to vary depending on your specific condition. The second thing that we're looking at is consistency of training within your own abilities. So what we mean by that is, you're going to run into obstacles when it comes to working on your neurological condition. You're going to, be attentive in training and working on improving your condition, whether it be through resistance training, aerobic training, whatever it is that you would like to improve upon. Um, but we know that you're going to have days where you're going to struggle. Motivation may not be quite so high. Um, uh, it, a lot of factors come into play when we're looking at you improving or maintaining your neurological condition. So, all we're looking at is the consistency that you can provide to your training at your current ability level. The third thing, third and final, is the specifics of your condition, and specifics of your condition outside of it. So we're looking at things like your fatigue levels. Are you fatigue prone? Which meaning that you are somebody who is susceptible to becoming tired easier or more frequently, or are you fatigue resistant, where you've got lots of energy and you have plenty to give towards whatever activities you want to work on. You may have flare-ups. That's very normal, as unfortunate as it is. And then there may be other health conditions outside of your actual neurological condition. It could, maybe you're dealing with a fractured shoulder. Maybe you've got hardware from a surgery. You've got pain from, back pain that's unrelated to your condition. Whatever that may be, your specifics of your condition and things outside of your condition are also going to help dictate how well you can maintain or improve upon your condition. And so, based on these factors above, your training and other factors that affect your health are either going to improve upon your mobility or it's going to stall it from further decline. So, if there are any questions, this is just the first slide. So if anybody has any, specific questions related to the stuff we just covered here, please go ahead.
Yeah, and I see that there was someone with a hand raised. Just from a psionic policy perspective, when we do these live sessions, we do record them so that we can publish them on our website for people who weren't able to attend the session. And so during the active recorded session, we're not going to call on anyone live just for privacy reasons, but please do send questions through the Q&A. And so since I don't have anything open on this topic yet, if you do have a question, feel free to submit it here and we'll make sure we answer it on the next slide. But just wanted to share kind of why we don't call on people during the live recorded portion of the chat.
Okay. Aerobic exercise. What we're looking at is, why is aerobic exercise important in relation to your neurological condition? So first off, aerobic exercise is absolutely proven to improve your cardiopulmonary health, so your heart and your lungs. And then we're going to just trickle that down into blood flow and circulation. Movement in general, it doesn't even matter how small the movement is. Movement in general is going to improve your blood flow or your circulation throughout your body. So if and thinking total body is good. So whatever movement you can get throughout your whole body is ideal. That blood flow improvement helps send blood and the necessary metabolites to, allow your muscles to function optimally, and it helps in the recovery of your muscles. So if you are training, you break your muscles down, and the blood flow that gets sent to them actually helps aid in rebuilding them. So circulation is a huge bonus. Further, going along with the blood flow, we're just going to transition into the digestive tract. So when we're looking at movement again, there is improved blood flow to the tissues of your organs and your gut, your colon, everything that your digestive tract in general is going to also receive the benefits of that increased blood flow. Plus, the movement that you do is actually going to help with what's called motility. It's how your gut moves everything through those tubes to come out. And so the more you move, the better your body will digest and move things through the digestive tract. Cognitive maintenance. It's a huge, important factor for cognitive maintenance, and it can be kind of coupled in with the one below it, which is the short-term mood boost. So it is largely understood that everybody gets a release of endorphins as they go through really any kind of exercise, aerobic being one of them. And so you get that short-term mood boost. It helps with the connection of those synapses in your brain. So it helps with, keeping you a little bit more keen, keeping you sharp. It's good for memory, for spoken language, anything that involves your brain, which covers, your brain runs everything. So aerobic exercise is vastly important for all of these things to be improved or maintained.
Great. And we don't have any questions right now, so we'll keep moving forward.
Okay. Resistance exercise. So this is important information that I wanted to share with people because not a lot of people know this. So when we're looking at resistance exercise, everybody kind of thinks, oh yeah, that's the thing that I do in order to, build muscle mass to get the definition that I want to see, and then improve strength. So the first thing that we want to talk about is the nervous system in relation to the muscular system when we're talking about resistance exercise. So the thing that people don't recognize is that the nervous system is the first thing that actually develops strength in your body. So that's why if you went to the gym and you were doing a bicep curl, you don't just immediately after the first couple of weeks, you don't see really any change in your muscle. It takes several weeks to several months to, gain that muscle mass. The reason being is your nervous system is what gains the strength first. So as you repeatedly exercise or give yourself resistance, if we look at something like dorsiflexion, where you're lifting your toes up, as you repeatedly perform that, your nervous system is the one that takes the brunt of that load. And so your nervous system will start to be able to withstand greater resistance or be able to do more sets or more reps as it gains strength. At a certain point, your nervous system grows tired of taking all of the work and doing all of the taking care of everything. So that's where the musculoskeletal system comes into play. The nervous system says, hey, I'm tired of maintaining all of this. I'm going to have you lay down a foundation of muscle so that way you can maintain what I've already built. And that's when we see roughly 6 or so weeks after repetitive, consistent training that you start to build muscle. And that's, again, the nervous system not wanting to be the sole proprietor of all of the work. And so muscle builds. And as that muscle builds, it maintains what the nervous system has done. And so then it just becomes this teetering effect. As the nervous system grows stronger, so does the musculoskeletal system increases muscle mass, and then the nervous system gets stronger again, and then it lays down more muscle, and it repeats that process. And it's the same when it comes to atrophy, when we look at the decline of strength or endurance. So if you become more sedentary, you actually you lose that strength and you lose that mass in the exact same order. So if you were to be sedentary for X amount of weeks, X amount of months, your nervous system will weaken first. You might not be able to lift the same amount of weight, but you may maintain some of that muscle mass. But as the body starts to recognize that you're no longer providing a stimulus, the training that you've been doing, it's going to start to take away the muscle mass that you applied because it recognizes that it no longer needs that muscle mass. So this is where resistance exercise and consistency of resistance exercise is very important. And then just to cap it off, just like aerobic exercise, there are the cognitive benefits. It gives you that short-term, happiness with the release of the endorphins. And then another thing that's very important is the specific exercises that you can do, the specific resistance exercises that are have a big carryover to gait. And so we specifically want to look at dorsiflexion, the lifting of your toes, knee flexion, the bending of your knee, and then hip flexion, the lifting up of your knee lifting upward to bring the whole leg up.
Great, Dylan, a few questions from the group. The first question is, so if there is no movement, there will be no maintenance and therefore decline.
That is correct. That's very to the point. Yes, I actually couldn't have said it better myself. No movement equals decline. There's no other way.
Okay, and then one additional question, which is how much and how often is aerobic exercise recommended?
So this is where I was referring to earlier when we started the session. We actually have a whole section on part 3 where we're going to discuss the prescription of exercise. So this is where I'm going to make you stay tuned. It's a little cliffhanger for you. You'll have to opt in these next couple weeks so you can find out.
Okay. All right, we'll head on to the next topic.
Great. All right, the SAID principle. So SAID stands for the specific adaptations to impose demands. So what do we mean by this? Not a lot of people understand what imposed demands are and what specific adaptations are. So imposed demands are any activity or any exercise that you do or that you technically don't do that places some kind of stimulus on your body. And stimulus is just something that your body recognizes and responds to. So the stimuli, the multiple stimulations of the body, these can be considered stress. So when we're looking at something like doing dorsiflexion, that would be considered an imposed demand, something that you're demanding that your body does, and then it's considered a stress. A lot of people that have worked with me, I discussed the idea behind positive and negative stress in terms of eustress, which is normal, healthy, positive stress. It's a good thing for your body. Any kind of exercise that you do, anything that you do to train your memory, anything that you can think of that stimulates you in a positive way is what's considered eustress. Distress can be anything negative. So, taking in negative things to your body, watching negative things, hearing negative things, or even just the lack of doing something can be considered distress. So when we look at eustress, this promotes healthy improvements to your mobility. And then inactivity, what would be considered distress, promotes decline in mobility. So now that we've discussed that, specific adaptations are the changes that your body makes in response to those imposed demands. So for example, a eustress would be getting up and just walking around daily. That's positive for you. It's healthy for you to do. And the more you do that, the more consistent you are with it, you are applying positive eustress to your body. And the specific adaptation to that, to walking daily, is either maintaining or improving your mobility. Distress would be considered remaining sedentary. Now, just so you know, it's not necessarily a negative to be sedentary. You can have a day, you're allowed breaks, you're allowed to take days off. Everybody's going to have ups and downs with their training. So just know that like a couple days here and there of being sedentary is not going to completely destroy you. It's not going to, cause massive decline. It's something that would need to be done over a long period of time. So I just wanted to make sure that people know that we're not saying that you need to be, Superman every single day, because nobody is. Remember, we're wanting you to work within the abilities that you currently have, whether that and that's going to change on a day-to-day basis because of these neurological conditions. So the distress of remaining sedentary over a long period of time, the specific adaptation would be decline in performance. As somebody asked before, it's the doing nothing causes decline in performance.
Thanks, Dylan. Before we head on to the next slide, we did get a question. Are the sleeves primarily beneficial for supporting movement or building strength and neurological pathways? So should the sleeves be used for more training or for assisting with walking?
So both. It really depends on what you want to get out of the sleeve. Um, Again, I'm sure there's a couple of people here in the chat that I've discussed this with them, so they know. Um, I tried to tell people that to use the sleeve in both contexts, so that way you can realize where it's most beneficial for you. The sleeve can absolutely be used as a very specific training tool for your gait, where it's going to hopefully help improve with your dorsiflexion, your knee flexion, helping with your step length, helping with increased stability. We're looking at all of these things from the sleeve. Ideally, the sleeve makes things a little bit easier for you, and so then you can use it as a specific training tool. If we're looking at something like if you're wanting to increase your endurance, you have the sleeve. You could leave it on your body. You have it attached to your leg, but it's turned off. You could walk until you reach a point of fatigue, where you're like, all right, my leg's starting to kind of drag. It's becoming, uncomfortable. I'm not enjoying this quite as much. That's when you could kick the sleeve on. The stimulation comes in to assist and make things a little bit easier. And then it should help you work through or push past a threshold that you previously weren't capable of. So, we see a lot of people as they start to use the neural sleeve consistently, just the steps per day that they take increases. And so that's a product of um, ease of um, ease of your mechanics. It's helping you with those specific things that ail you while walking, and it takes kind of the load off, and allows you to focus on some other things. We know that the neural sleeve does not specifically treat hip flexion, but because it's taking over so many other processes of your walking for you, it actually allows you to make that a focus of your training. So you don't have to think about all of the other things, and you can actually work on your hip flexion. It's why we see a lot of people make hip flexion gains with the neural sleeve. So in that context, the sleeve is great for specific training. And then with the exercise modes, obviously for, strength building, endurance building. But as the former part of that question is, you can absolutely use it to just make walking easier. The sleeve does not need to be this thing where it's specifically like, all right, the sleeve's on, I'm just training, I'm working hard. If you just want to go on a leisurely stroll and just not really have to think so much, the sleeve is also great for that. So it's just finding um, what, you know, where it brings value to you and how you want to use it specifically. There is nothing wrong with you just wanting walking to feel easier and not having to concentrate on it. But if you want to make some more specific adaptations to impose demands, doing using it as more of a training tool and having a dedicated period of time where you use it to train is a very good idea as well. I hope that answered the question. I know I kind of trailed off on that.
Yep, thanks, Dylan. And then there's one other question. My calf muscles have gotten larger due to my neurological condition, not exercise. I am told this is a reason for my spasticity. How can the sleeve help me in this regard?
I'm unsure about the growth of your calf in relation to not exercising or and because of your condition. But what I can say is that we do get people that when they're wearing the neural sleeve consistently, they actually do. Not everybody, but a lot of people do have improvements to their spasticity. Not full elimination, but decline in their spasticity. So a lot of times we'll use the sleeve in the walking mode. And so for something like that calf spasticity where you just, your toes are wanting to just pull down and it makes it hard to lift your toes up, having a sensory level of stimulation while walking. So, separating sensory from anything else is that level of stimulation where your brain is aware, you can feel it, but it's not causing this big, strong contraction of the muscle. It's just your brain is cognitively aware that the stimulation is happening at the calf. And so we see a lot of people that use the neural sleeve in this way while walking. have improvements to that spasticity. So I don't know how to answer the question related to, your the mass on your leg growing, but I can address that spasticity side of things.
And Dylan, I can just jump in
Yep, go for it.
too. Yeah. Yeah, to Dylan's point, I'm not exactly sure about the calf growth. However, when individuals have spasticity or hypertonicity, or what we call increased tone in a muscle, that muscle is in a more contracted state. And when the muscle is contracted, it is not as flexible, not as movable, and it may sometimes appear larger. So like, for instance, like if you're at rest, your bicep has a particular size and shape, but if you were to flex your arm, that muscle would potentially look larger, or your arm would look larger. So that sometimes that visual representation happens when you have increased tone or increased spasticity in the calf, where that muscle is contracted and may appear to be larger. I'm not certain if the actual muscle bulk is larger, or if it's a factor of the spasticity as well.
There was also a comment from another member of the community who experiences this, who said, my doc said that increasing calf size is fluid retention from not moving. I have fewer spasms now, but still have fluid. And so elevating the legs and working with a physical therapist for edema reduction has been helpful.
Yeah,
To share that
absolutely.
community.
Yeah. So, yes, if the size of the calf, or any muscles related to edema or swelling or fluid retention, you will visually, it may look larger. So walking is one of the best ways to improve edema. So the muscle pump of the calf muscle helps to move that fluid out of the legs and back into the circulation. Elevating the legs for sure can help also bring the fluid back into the circulation. So if that is the case, that fluid is the result, then there are ways to specifically address that.
Yeah,
Yep,
and then, sorry, just to segue off of what Becky said, with the muscle pump and walking. So, essentially we kind of covered that with the, the aerobic exercise in the previous slide. The improvement of circulation, the blood flow. So that's part of it. So, because we're, standing up tall, gravity is working against your blood going back up to your heart. So I just wanted to explain what the muscle pump was. So what Becky said. So as you're using your lower extremities while walking or doing whatever exercise, so you've got blood that travels throughout your body. And again, it has to work upward against gravity to get back to your heart once it goes down to your legs. And so as those muscles contract, while you're walking, it helps pump the blood back up. So again, I just wanted to make sure everybody understood what that muscle pump action was.
Thanks, Dylan.
Yeah.
Thanks, Dylan. And one other person mentions using a lymph machine daily to help reduce some of that fluid. And then just a comment that the edema can negatively impact the stimulation reaching the muscle. Becky, I don't know if you want to speak to that as well.
Yeah. So when you do have swelling or edema in the leg, that tissue, the electrical current gets dispersed as it travels through that kind of fluid. And so that the current doesn't have the same direct path to the muscle that it would if you didn't have swelling or edema. And so you may see that it is you have decreased effectiveness of the stimulation when there is swelling in the leg.
But to that capacity, doing the opposite, finding ways, as Becky said, having somebody that can help assist you, or if you yourself can find ways to help eliminate that swelling, then it's, or at least reduce it, it's going to make everything better. It will improve just your maintenance of movement because you're moving, but then also it's going to hopefully help make the sleeve more effective because hopefully as you move more, that fluid gets flushed out and then it decreases the swelling, which will hopefully decrease that separation of the fluid between your skin and the muscle where the the pads try to send that stimulation through. So movement, again, just making sure everybody knows the more you move, the better it is.
Great. All right, let's move on to the next topic.
All right. So in this slide, I just wanted to give some specific examples again behind the said principle, just so there's some further understanding. So, the example of performing regular toe raises weekly with increasing challenge over several months. And so let's break this down a little bit. So the toe raises is the exercise. This is something that you would perform several times per week. Typically, we want somebody to operate within the realm of 2 to 4 times per week, depending on, you know, your specific capabilities. And then when you perform these exercises repeatedly over time, with increasing challenge, that's the big ticket. There will be some general improvement. So like, you know, I'm sure a lot of you are familiar with physical therapy. You guys get prescribed the 3 sets of 10 quite often. That's great for starting. However, in order to continue to make improvements over time, you have to do something beyond those 3 sets of 10. So if you've been doing the 3 sets of 10 for months, and you're probably not likely seeing a lot of improvement because there's not anything that's been changed. A lot of people, if you know this, they talk about plateauing. So initially you would start with that 3 sets of 10. And so you're going to see that your body's like, oh, I'm doing activity. I need to get stronger to get better at this. And then if you just continue to do that, your body's going to reach a point where it's like, that 3 sets of 10 is really easy. I feel comfortable just performing that and I'm going to stay here. So we need to find some way for you to increase that challenge in order to, you know, make further improvements. And there are so many different ways that you guys can do this, just so you know. So if we're taking that base 3 sets of 10, you can add an additional set. So just doing 4 sets of 10, that increases the amount of work you're doing. So then your body's going to say, oh, I have to actually get a little bit stronger here because I'm doing more than what I was doing previously. You could do, instead of 4 sets of 10, you could do 3 sets of 15 or 3 sets of 20. And in that regard, you're still increasing the amount of work you're doing. You can add resistance. So you could put like a little ankle weight around at the tip of your toes or use a resistance band to make it a little bit more challenging to get your toes up. There are so many ways that you can find, even just changing the angle at which you move can create a difference for your body that creates a new challenge. So that's what we mean by increasing challenge over several months. As you continue to do more and more work in different capacities, you will gain strength in your shin, and the goal is that additional strength and additional endurance that you get with your muscle that lifts your toes up helps you with dorsiflexion during gait. I wanted just to give another quick example. I think actually, I think we covered this already. So eustress, getting up, walking daily is the imposed demand. And then the specific adaptation is maintaining or improving mobility. Distress is remaining sedentary, and then having decline in mobility from not, you know, performing regular work.
Thanks, Dylan. We'll keep moving forward. There are a few questions that we are going to save for the very end, but keep posting the questions, everyone. Thank you.
Okay. Relating exercises to your specific activities of daily living. I know a lot of people are not big on these clinical words, but I want you to know that you guys are biological organisms. And I say this specifically because I could say you guys are human, but also animals and insects and all of these things. Anything that's a living being is considered a biological organism. And in being a biological organism, you respond to daily, weekly, and monthly stressors. That's the things we talked about: eustress, distress. that ultimately are going to shape how you move and how you eventually will move. And so that could be you moving now and either moving better later or not moving as well later, depending on what you do and don't do. And I wanted to give an analogy, I call it just the efficiency analogy. So again, you being a human, your body is designed to be as efficient as possible. We can't do anything about it. It's just the way we're made. So, in being a machine of efficiency, your body is going to do everything it can to take the path of least resistance. And I'm sure a lot of you are very familiar with that path of least resistance. Um, we can look at something uh, like as easy as atrophy of your muscles. So again, if you have decreased movement or no movement at all from whatever your condition is, you're going to start to see that your muscle mass is going to decline, your strength is going to decline, your endurance is going to decline. And the reason being is because your body is trying to do everything in its power to reduce the energy output. And this is including but not limited to your ability to move, the amount of muscle you have. It'll even reduce your cardiac output. So, like how well your heart works, because it's trying as much as possible to not do as much work as possible. And that's why it's good to bring in these positive stressors, such as walking as regularly as you can, such as doing specific exercises that are going to help improve your gait. These require your body to make adaptations and not take the path of least resistance. That's why we want to give you resistance exercises, so your body is forced to make beneficial changes to make your life easier. So putting in a little bit of hard work now, doing things that are not easy for you, can make other things that currently aren't easy for you easier in the future. And so, you're putting you're paying yourself dividends now, so that way you don't have to deal with the stress of lack of mobility in the future. Um, and then aerobic training. So if with aerobic training, as you do that, you get your heart rate up, your lungs are working, you're breathing more, you're sending all that blood flow throughout your body. As you train that, we talked about your cardiopulmonary system, your heart and your lungs get stronger. And then with that, you have a greater capacity to walk across all types of environments. And this is in regards to distance traveled, but also ease of travel. So somebody who is less aerobically trained is going to not be able to walk as far, and that distance that they travel is going to be more difficult. It's going to put more stress on their heart and lungs. Somebody who is more aerobically trained is going to have an easier time going further distances and with less or with more ease. So that's what we're looking at with these exercises from resistance and aerobic training in relation to just your regular daily activities.
Dylan, one question related to this topic, and I'll start with you, and then Becky can add on if she has additional comments, is if I feel burning nerve pain in my legs, should I push through and move or exercise, or should I rest then?
I'm going to say probably not, but I will defer to the physical therapist in the room.
Thanks, Dylan. So, in terms of burning nerve pain, we don't want to do things that exacerbate that nerve pain. Yeah, I think it is still important to move. Maybe taking a break from specific exercise is appropriate. It doesn't necessarily mean you need to not do anything that day unless it is so painful that you are unable to move. But basically, what I would recommend is not performing activities or limiting activities that are making that nerve pain worse. I don't know about the condition that is creating the nerve pain or what those symptoms are for this individual. Is this a constant nerve pain? Is this something that fluctuates, comes on and off? But generally speaking, we don't recommend activities that are making that nerve pain worse.
And then if I can segue off of that, finding somebody like Becky who is, if you can, if it's within your budget and within, your means of reaching, finding somebody that is like Becky, that's a qualified professional that can hopefully help you figure out what those things are is going to be, the best, probably one of the best things you can do. If you wanted to share any more on that, or
Nope. We'll move on to the next topic. Here we go.
perfect. And so this section, these are just exercises that are specifically tied to your activities of daily living. So again, putting stress on your body, the positive stress, regularly performing squatting like activities is going to help you with sitting to standing. Anybody that's done any level of physical therapy or any kind of personal training, you're probably very familiar with this. Squatting is very helpful for that. Lunges are effective for helping you get down to the floor if you need to get something, and from getting up off of the floor if you've reached down to get something. And then obviously we just discussed this, but the big three flexion. So dorsiflexion is lifting your toes up, knee flexion is bending your knee, and hip flexion is lifting your leg upward. The big three flexions, these things are imperative to your success with gaits. There's no other way around it. And so again, with the neural sleeve, we can specifically help with the dorsiflexion, with stimulating to help lift your toes up. We can stimulate your hamstrings to help bend your knee a little bit more. With those two stimulations, though, it's ideal for you to perform these actions on your own as well, practicing with and without stimulation. We want you to, again, challenge yourself, doing things that are difficult now to help make things that are currently difficult easier later. And so just because the neural sleeve can, help you with your toe lift and bending your knee, it's good to not just be passive in that stimulation all the time and actually do activities to help improve it on your own. And then again, the neural sleeve does not stimulate for hip flexion. So any kind of hip flexion training that you can get in to help you with lifting your leg up to gain clearance from the floor. Remember, for a lot of you, your big ticket item for walking is just getting clearance from the floor. Depending on your specific movement capacities, getting dorsiflexion and knee flexion may not be enough. Just because we can stimulate for it does not mean that it's going to be everything that you need to be able to walk effectively. And so training for hip flexion to make lifting your leg up to get clearance from the floor easier is hugely beneficial. And for me and a lot of people that work with me, they know I talk about it all the time. It's probably the most important thing for you to train outside of your toe lifting and knee bending. All right, weight bearing versus non-weight bearing exercise. So weight bearing exercise obviously is anything where you are, letting gravity affect you in some kind of standing position. So with this, we get the improvement of bone density. A lot of people, or you'll see it a lot. They say like your bone density stops improving or whatever after the age of 25, but it's not true. I know some people that do OsteoStrong. For all of you OsteoStrong people out there, anything where we're applying load to the body, where gravity is working against you, it's placing stress on your bones. And your bones are very similar to how your muscles respond in that they will get stronger as they experience this resistance. So anything that you can do that where you bear weight is hugely beneficial for your bones. And then to segue onto that, it helps with the resistance to impact. So I know a lot of people, when it comes to walking, impact is a big word. when we look at things like falling and whatnot, being able to withstand impact as you walk is going to make walking through environments a lot easier. So weight bearing activity such as walking, as you plant your weight down onto the ground, you are absorbing that impact. So your body's ability to resist impact is further improved based on these weight bearing exercises that you would do. And then the last part is anything that's weight bearing is the most applicable to real life, meaning it's the most functional. Walking being the number one thing. As human beings, we are designed to walk. That's our primary mode of movement. We start out crawling, but we are designed to become upright and walk on two legs. And so the more that you can do that weight bearing activity, where you're, promoting upright behavior, that's going to be the most applicable to you, improving or at the very least maintaining your current ability to move. When we're looking at non-weight bearing exercise, this is just stuff where you're seated. You're not necessarily having weight on your feet, or you're not necessarily standing up. And non-weight bearing exercise, if it's the best thing that you can do if you are unable to do anything weight bearing. So at the very bottom, anything is better than nothing. If you are unable to bear weight and do exercise with bearing weight, then doing anything you can in a non-weight bearing setting is going to be just as beneficial. And then when we look at the middle part for non-weight bearing exercise, as you perform that exercise, you can develop strength and endurance enough to the point where you can actually use that improvement to transition into weight bearing exercise. So, do again what you can. If you can do weight bearing exercise, please do it. If weight bearing is either highly challenging or you feel like it's unsafe, start with non-weight bearing and then see if you can work your way into weight bearing exercise.
And then I'm sending it over to Becky briefly. There's a question: is a power plate for bone density worthwhile?
Good question. So a power plate, I'm assuming the reference to a power plate, they're it's like
Big
this
vibration plates.
vibration. Yeah, it's where you stand on it and it vibrates. That has many kind of uses. But to Dylan's point, anytime that you are weight bearing, you're gonna promote sort of bone growth or bone turnover. And so the added vibration and you having to stabilize against that vibration in the standing position can certainly help with promoting bone density. There are other applications as well in terms of balance and proprioception and things like that.
And there's another question on this topic, which is there any issue doing EMS personal training at places like Body 20 when not wearing the sleeve? The two types of stimulation won't interfere with each other.
I don't think it should.
No, that's fine.
Great. And then we'll have a few more questions that we can ask at the end. So I'll just keep moving forward.
Okay. So this is the end that I just wanted to lay out some key takeaways for everybody since, we cover a lot of stuff. There's, a lot of information to digest in this, and I know it's recorded, but it's still good to just have some key takeaways at the end. So at the very top, we've got exercise in general, no matter the capacity, is going to have some kind of net positive effect on your health and well-being. So it just goes back to what we said earlier. Anything that you can do is going to be good. So whether it be non-weight bearing, weight bearing exercise, just trying to make it as specific to the things that you want to improve upon, you're going to start again, putting money in the bank towards those positive changes that you want to see in the future. So in general, anything that you can do with the best of your ability at some level of relative consistency is going to be good. As I said, specific movements correlate to specific activities. So, you know, keeping things as specific to what you want to improve upon as possible, the better. As I said before, performing weight-bearing exercise as often as possible is ideal, but if you can't, doing non-weight-bearing exercise is highly beneficial and can help you transition into being able to do weight-bearing exercise. And last but certainly not least, if unable to do on weight-bearing activity, do what you can. There is nothing wrong with even if we look at it this way. I work with a lot of people where they're like, I can't move my toes at all, and that's okay. You can still think about doing it. You can actively try to do that exercise. Even mental reps can help you visualizing. So even if you can't do an activity in general, we're going to take it even a step further back. Those mental reps are hugely beneficial. I've talked to a lot of people in training sessions where visualization and just seeing themselves do something and then actively attempting to do it is still going to promote positive impacts, and it's still putting money in the bank towards making those improvements.
I just want to echo that for what Dylan said. I think that is a super important point, is that even if you're unable to perform a movement, you don't see any active movement, just connecting your brain to that movement is beneficial. So.
Okay, great. So now we have entered the Q&A, the final Q&A. So please keep sharing your questions. I'll do one. Actually, Dylan, I'm going to go to the next slide really quickly just to talk about the upcoming events, because there is a question
Yes.
about will we be providing hip flexion exercises in one of the next sessions?
Yeah, so Adam and I, as you can see, we are here to pump you up. We're going to pump up your hip flexors and all of your other muscles. So we'll help you out. We'll cover specifics of exercise in relation to the apps and the exercises within the Psyonic app, and then some things that you can do that are not related to the Psyonic app. And then part 3 is just discussing prescription of exercise and, you know, thinking more along the lines of programming and what you should be doing or what you can do for exercise.
Great. And then now we'll answer a few final questions. Let's see, Becky, maybe I'll send this one to you. I find myself fighting the stimulus to stay balanced. Is this reinforcing compensating movements? Do the sleeves recognize this? Should I relax my muscles more and let the sleeves do more of the work?
Okay, I'm gonna tackle that very first part. If you feel like you are fighting the stimulation, then I think that best to re-meet with your mobility specialist to take a look at what your current parameters are. So ideally, the stimulation, we don't want it at a level where you're feeling like it is not actively helping you and that you're kind of fighting against it. That's not going to benefit you. I'm not sure if it's, you know, trying to relax into it is like I said, it's best to reconnect with the mobility specialist to take a look at how those parameters are set up. If you don't, you know, I could say just in general, if you don't, between now and when you are able to meet with your mobility specialist, I would recommend turning things down so that it's not at that sensation where it's like too much. So even if it is not as effective at a lower level, potentially turning it down, I would recommend turning it down to a level where it is comfortable and you feel like you can work with it, even if you're not maybe seeing the same improvements to dorsiflexion or whatnot. We want to get it to a point where you're not fighting it. And sometimes that requires a process where we start sometimes at a lower level intensity where you may not see the same visible changes in gait, but we then slowly kind of ramp it up as your brain and body accommodate to the stimulation. So yeah, if anyone is feeling like they're fighting against the stimulation, definitely
Then you're
check in with
experiencing distress and not eustress.
distress. If it is distressful, yeah, please reach out to support, or if you know your mobility specialist, you can reach out and schedule a follow-up. And in the meantime, I would recommend turning it down overall. If there are specific muscle groups that you're feeling are particularly having that impact, you could potentially just turn those off and see if that improves that in the meantime.
Yeah, and someone had,
Wouldn't
I
mind,
will
see
say,
me.
oh, go ahead. Yeah. I was gonna say someone had a related question that sounds like a similar experience where it was it was the first time out walking with the sleeve, and it was like the brain couldn't keep up with the stimulation, and so I've turned all the settings way down so I can continue. Is this something that I'll adapt to?
Yeah, generally speaking. So I often, a lot of people have had braces. So I use the braces example. So when you first get braces, your tongue and your your basically your tongue's like, what is this in my mouth? And the brain has to kind of incorporate like, oh, I have braces, and that's kind of part of what my is going on in my mouth. Same thing with the sleeve. When you start using the sleeve and you have all of this stimulation and it's sensory and motor, the brain is kind of like, whoa, this is a new thing that I need to incorporate into my walking. And so again, there's a process there. And everyone is a little bit different in terms of like how long that takes for the brain to kind of get used to it, but it requires some repetitive use. So kind of being consistent with using it even for short periods, daily to get the brain to get used to that stimulation. And again, it's appropriate if it's feeling like it's overwhelming or too much to turn it down. Again, good to check in with your mobility specialist to see sort of a good program. Like maybe again, it's starting with just one or two muscles and then adding the others in potentially, or starting with all four, but just at a lower level.
Yeah, I wanted to specifically say what Becky said. So a lot of people I talk to them, if you are feeling overwhelmed, it is a great idea to reduce the amount of muscle groups you have. It can be overstimulating. So if you're feeling like there's too much, even with lower level, like she said, drop muscle groups off. And what I'll recommend is typically the most important are shin and hamstrings. So it's a good place to start with those two, and then you can start work on slowly incorporating your calf and your quads. Typically, those are the two most useful things for you.
And to turn, so for those who may not know how to turn them off, if you have all of the muscles available and enabled, to turn off a muscle, you would simply turn the intensity down to 0 and test it at 0, basically confirm you want 0 stimulation, and then advance to the skeleton screen.
Great. Next question, going back to what Dylan said earlier about to find a Becky to work with locally, do any recommendations for how to find a good kind of movement specialist or PT locally?
That's a
It's
good
tough.
question.
They're not all the same.
Um, yeah, I would I mean, you can connect with your doctor who may have a recommendation. You can simply do a Google search of physical therapists in your area. I would look for those who have experience with individuals with neurological conditions specifically. Um, I think I'm just going to say as more and more individuals are using the sleeves, more and more physical therapists are becoming familiar with the sleeve. And so hopefully as everything expands, we'll have better better referrals for individuals in terms of where is a place where they are particularly familiar with the sleeve as well. But in terms of just finding a physical therapist, I would recommend looking for someone specifically who knows neurological conditions.
Yeah. And I think that person was very specific about like that burning nerve pain. So at the very least, just seeing somebody to get that figured out in general is going to be good. So even if they're not a great, neurophysical therapist, at the very least, getting your burning nerve sensations worked on is gonna, help you in everything. So find what you can, if nothing else, if you can't find a specific neuro PT.
And a few additional resources from our community. One person recommends the Neuro Studio, so they may have PTs in your area, and they're movement specialists who work with people with neurological conditions. So we love them. We also love Dr. Gretchen from the Missing Link. So I think they both said that both of them could be good resources for finding someone locally with neuro expertise.
The MS Gym also has quite a network of individuals. Yeah.
Yeah.
And then we did get a question, are we planning any clinics? I think if you mean like an actual permanent psionic clinic, no immediate plans. We do occasionally have, demo days and things like that at our facilities, but really we're expanding this relationship with the clinical network. It's been amazing. I think the response and the positive response we've had from the clinical community. And so we're, as Becky said, really kind of expanding that capability now. Just a few last questions. I know we're just past time, but we've got a few more. So one question, I have MS and I'm in a wheelchair. I can walk about 70 steps with a walker. My question is, how do I improve my balance?
I can answer that. So I've worked with people that transitioned into a wheelchair and then are actually in a very similar spot to you. One of the people I work with is they started somewhere around like 40 or 50 steps on their own. Just getting up and it sounds too simple to be true, but getting up and doing something, doing anything, setting a little goal for yourself. With one of the specific people I worked with who was starting around that 40 to 50 steps range. If you know that is your current level, try to set a goal to get, what did she say? Or what did they say? 70 or so. So
70.
set a goal, try to get 80 one of these days. And it might be like you have to push to get it, but try to get 80. And then once you reach 80, try to get 90. And you're just setting these little tiny goals for yourself. I tell people to zoom out, take a big picture look. You don't need to be looking to make these huge leaps and bounds in a short amount of time. You need to make these little tiny goals and they snowball and get bigger and bigger. So that would be my number one recommendation. Get up, walk to the best of your ability, and try to achieve just a little bit more than you have been, and then build upon it.
Yeah, and I'll just add on to specifically about the balance. So to Dylan's point, the more you can add those increments, strength improves balance. So the more you're walking, the more you're weight bearing, you're improving your strength. I do always recommend people stick with their assistive device if they use an assistive device, particularly, well, always if needed, but also particularly in the beginning, because using that assistive device for balance allows you to then not think about balance as much and focus on the walking components, so that you can strengthen within those walking components. And then there are specific things, weight-bearing type standing activities that can improve balance. I'm not sure if Dylan and Adam are going to address any of those. But really, it's kind of like Dylan said, these incremental improvements. The other thing with the sleeve and with walking is proprioception, or your sensation of where your body is in space can improve as well. And proprioception leads to improved balance. So if you know where your foot is, where your leg is moving, you will generally have improved balance.
Great. Two final questions. The first, can using an elliptical machine help with improvement of mobility?
Kind of.
Dylan, do you want to take that?
Yeah. So kind of. An elliptical is not going to directly imitate normal gait. It's just not. In regular gait, there's called ground reaction force. You actually have to push into the ground to take a step. You don't get that with an elliptical. And a lot of the times, once you get going on elliptical, it becomes like a, I'm trying to figure out what the right wording is behind it, but it starts to kind of move for you. It's like a momentum based machine. So at a certain point you're doing less work, which is fine. If you want to get again, if you want to get some kind of movement in, if an elliptical is the place where you can get some weight bearing movement, elliptical is fantastic. Please do it. But if you can walk without an elliptical, that's going to be your better your better practice, the better thing to do. But an elliptical is fantastic if it is something that you can do.
Yeah, I would mimic
Great.
that too. If you do have like a treadmill, that mimics walking more, but the elliptical, like Dylan said, you're still going to get cardiovascular, some aerobic, you're going to get joint motion, keep the joints mobile. So there's absolutely benefits of any movement, like Dylan said in the beginning, any movement is beneficial. But like Dylan said, it doesn't directly translate to necessarily to specific improvements to walking.
And then there's a question, what about a stationary bike?
Yeah.
In terms of walking or just exercise in general? Same thing. It's going to be great for great exercise, right?
Yeah, but not directly directly translating to a specific gait.
Great. And then one last question. My spasticity seems to be worse in my shin since restarting use of my sleeve. Prior to that first 2 weeks, I had the sleeve were amazing. I want that again. I cannot take baclofen. I already use heat and massage and see a chiropractor. Are there any other suggestions?
Well, and I want to, so we can get context. When they say shin, do they mean the front of their shin, or do they mean the calf and the back?
I'm assuming that it is the front. I'm assuming it's like dorsiflexion.
Okay. Then if you want to go for that.
Yeah. Yeah, I think again, if you're having changes or you're seeing changes from what initial setup, it's good to make an appointment with a mobility specialist so that we can kind of assess what's going on. Yeah, if you're coming, again, we don't want the stimulation to be increasing spasticity. So it may just be a matter of turning down the frequency to help with that. There may be, it's worth a conversation. Are there other things outside of using the sleeve that are impacting spasticity, which could be temperature or stress or other health, you have the flu that can impact spasticity. So I think that's worth having a conversation with a mobility specialist to see if we can make adjustments.